What if your path to grow your company is not about spending time figuring out new features for your product and services, but doubling down on the right people who are making 80% of healthcare decisions for themselves and their family? Today, we have two amazing guests that are sharing their insights and strategies on how you can scale your company by supporting the entire health ecosystem. Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability. Here is a technology secret you need to know in healthcare. 93% of the company are focusing on the wrong target entirely. If you're not talking to the people that actually make decisions to buy from you and you are making it overcomplicated, then no matter how much money you have to throw at marketing and sales, it's not going to convert. Today, we have two amazing interviews that I conducted at Vive conference in 2024, where we discussed with Gil Bashe from Fin Partners, who is an expert in healthcare communication and technology integration, where we discussed how critical is getting caregiver involvement in creating successful solutions that actually gets people to adapt your product and services. Every patient that are using your technology solution have at least 2 to 3, on average, caregivers involvement with their care. So how do you leverage the entire ecosystem of individual patients as well as the clinicians to create the best trust so these patients can actually use your services and have other people to champion for the result and impact you're trying to create? Let's hear from our entire interview with Gil.
Hi, this is Sabrina Runbeck, and we're here at Vive with Gil. Thank you so much for joining us.
What a pleasure to be with you, and what a pleasure to talk about what you're doing.
Yes, we are at the Caregiving Worldwide Network, and what a joy to really bring in and interviewing so many founders with the technologies, the integration solution, wearables to solve a big problem for our caregivers.
You know, at the bottom line, though, what we're talking about, the Caregiving Worldwide Network it's about people. And you can have technologies, we can have a lot of information available, but we can't forget that this is about humanity and that people's feelings, the anxieties, caregiving is a very physical effort. And I'm not just talking about the physicality of putting your body into it. I'm talking about the physical exhaustion you feel, emotion. So, most certainly there's incredible advances in technologies. And many of the companies that are exhibiting here who really should be supporting programs like this, if they really do care about the outcome of improving people's lives. It's not just the patients, it's ultimately about the unit that surrounds that patient. It's parents, it's siblings, it's grandparents, it's uncles and aunts, and good friends. They're all part of that caregiving network.
Exactly, and now we see that as clinicians too, going into a room with the families there. And when they do have families and friends with them, their spirit is different, their understanding becomes more clear, and you have the right ecosystem to help them through the journey versus when people are doing alone. And sometimes caregiving is very lonely in that aspect, and so we are really representing the solutions to help prevent their burnout, to help them to connect it to the bigger ecosystem of solutions that they can tap into. Because no matter who we are, we're all busy professionals. We're all taking care of both ourselves and those of our loved ones.
Well, you said something just a few moments before that I thought was so important. This relationship between the physician, the provider's team, and the patient and the family. We often forget that physicians really are not trained in terms of the skills necessary in communicating with the patients, other than the procedures of the medicines. And certainly they can convey clinical information to the caregivers, but they don't have the time or the emotional bandwidth or the informational bandwidth to deal with the basics. And so that's left ultimately after the visit. It's kind of goes sorting out yourself. And that's part of it. That's part of the exhaustion, emotional, mental, physical exhaustion of the caregiver. The system, the medical system is really not set up to deal with the specifics of caregiving. And the sense of providing them with information that can help them navigate their life with their loved ones. That's a heavy lift. That takes skill. And it also takes an understanding on the part of innovators to recognize that you're not truly an innovator if you're not pulling it through to the basic level of people. All the people that are trying to innovate.
And we have such a big shortage in the caregiving space, and those paid and non-paid. And most of people who are taking care of their family, of course, they're not paid, and sometimes they have to miss work to just take care of their patients. Just like our founder, Tracy, she is not in this conference because she's taking care of her mom. And that spirit of what this company is founded in, and many of us who has from both the kids level, the parents level, grandparents, accidents, things that just cannot predict. And then sometimes we willing to drop what we do professionally and to serve our parents, to serve those loved ones. And so incredibly supported in that arena. However, it doesn't matter if they have medical background or not, it's still a very complex, confusing way to get the right resources, get the right solution. So having to, as you're saying, the technology solution, you need to really think about that holistic way of not just a patient, but those are surrounding them. How can we make things better and more synchronized as we move forward together?
Well, there's so much that has to be done. Part of it is the use of technologies, remote monitoring technologies. Part of it is just understanding how to access information. We're talking about, obviously, in this conference, the big buzzwords are always going to be right now, AI, Gen AI, ChatGPT. Caregiving, unfortunately, does rely on that somewhat, but the information that people are seeking is so specific. We've entered into the age of cognition. If you don't know what questions to ask, it's very hard to form the answers. So caregiving is really a very specialized skill. Now, we're talking often about caregiving for diseases we're very familiar with, but there are countless rare diseases or orphan diseases, difficult diseases, genetic diseases that are lifelong conditions. Try to imagine a set of parents dedicating their lives, organizing their lives to be caregivers for decades. As technologies change, as the emotional bandwidth goes up and down, as they age, caregiving really deserves this sort of attention. I think that you and your colleagues are directing toward.
Exactly. And then we so appreciate now there are focuses especially on the caregiving side. Yet, I believe one of the downsides from hundreds of companies that we have talked to, and then daily from interviews or other ventures, is that they are not actually speaking in the language of the patient and caregivers. When we ask them, how are you uniquely standing out, it seems like they are thinking too big and then too similar in other languages. So we believe when people really wanted to demonstrate their value and impact in this space, they really have to be able to niche or say in a way that everyone can understand to gravitate the attention as they come out in the market.
Well, I think that's the skill set that you and your colleagues bring to the table. I mean, Tracy from her life experience. But, I think that speaking to caregivers, serving caregivers, is a specialized skill. It really requires an understanding of the territory the caregiver has to deal with. But, some of the things that you're doing here at Vime, I think, really deserve greater reflection. We have all sorts of companies that are developing these days, new technologies, wearables, information technologies. And many of them, if not all of them, I don't wish to exaggerate, but many of them most certainly talk about the patient having a seat at the table, or patient centricity, or we're focused on the patient. If they're really focused on the patient, they're going to lean into supporting the caregiver. Because without the caregiver, I think all of these individuals have to appreciate the patient's best interests are not being served. So we often talk about the patient. I think we really need to talk about patient infrastructure. And that's really dedicating ourselves as people committed to championing innovation, making sure that it includes the patient ecosystem. I think that's something that has been said to me that I think we all have to reflect on, is we're sometimes patients, we're always people. Caregivers are people. They deserve our profound thanks, appreciation, and support, because without the caregiver really having the sturdiness, the emotional, physical, and sometimes, yes, the economic ability to care for that person, the system will care for them one way or another. It will cost us one way or another. We either support people who love that person, support that person, or our system will fall down.
Exactly, because everything is an ecosystem. So when we take resources and energy from one side, it has to be able to funnel into the other side. So when we're truly be able to put the patient and caregiver on the same table as innovation comes about, because at the end of the day, no matter if they're improving workflow for clinicians, better early diagnostic, and more accuracy, at the end of the day, everything is about improving the patients. And then if we're not involving the patient's caregiver up front, doesn't matter how thought out that is, you're not able to adapt those technology, or the end user are not actually getting the benefit as they're hoping to see.
Absolutely. So on point. I think a lot of the major patient organizations out there, and there are many doing exceptional work. Obviously, they're dedicating themselves to the science, trying to understand the science behind the condition and stuff. But we have to remember that often a lot of the support information in groups that are developed are really developed for the person with the condition. And often when we look at caregiving, people assume that if we're taking care of a patient for a day, let's say an Alzheimer's, and the family is getting a break for the day, that we're meeting the needs of the caregiver. That's very superficial. And I think that, again, the companies that are here, all the companies that are dedicated to innovation, from device manufacturers, therapeutic companies that are looking at new therapies, to companies that are dealing with wearables, implantables, and so forth. I think service companies that are developing, digital app companies that are developing, that it's a very unique, refreshing, vital point of view to make a commitment to the caregiver alongside the patient. Because if they're really committed to the patient, guess what? They're going to be committed to the support system and supports that patient's well-being.
Right, and then when they come out with these technology, they do have to break down into the cost aspect. Even though the app might be free, but someone is taking care of the caregiver in some way. So where are we leveraging Medicare, Medicaid, or some other way of employers to be able to support the whole thing? Because at the end of the day, everything is about sustainability. So we have to come up with the right solution to give the right resources and not overwhelm people with all the information.
Well, I was glad that you mentioned economics. Often we talk about this in terms of emotional support or infrastructure support. But the reality is just understanding the world of health insurance and different types of insurance, from Medicare, disability, Medicaid, Obamacare, private insurance. These are very complex issues, and caregivers often need to access law firms. They need financial consultants. So I would urge companies that are involved in financial management, household income management, to consider dedicating themselves to caregiving as a product portfolio, and also as their social impact. And I would also highly, highly recommend that companies that are involved in biomedical innovation actually begin to partner with those companies and develop products and support services, information that they can say, gee, we're keeping these people healthier longer, and it's a chronic condition. They really need a lot more information than just our medicine. We have a responsibility, since we're changing the dynamic of that person's life, to also consider what does that mean for the household.
Exactly. And that being said, is about even people have to pay out of pocket about the differences what insurance doesn't pay. Is there a fintech technology or other company to help them to make the payment plan, to help them ease the burden of all those high costs and integrate the solution? And that's what we also love to feature on the network is all the ecosystems of different solutions. How do we help patients and caregivers to decipher what's the right time to introduce these services for them, as well as when they have too many options, how do you decipher what's the best one to use and to be able to showcase and demo this for the right resources and audience and help them as a whole umbrella?
You know, as far back as, I believe, 1994, there were studies that demonstrated that people who have a shared concern will cluster together. So the concept of the caregivers network is still on point to what the data tells us. You know, whether you live in Ohio or Oklahoma or New York City or Los Angeles, where we are now, if you're a caregiver, you seek out communities, networks, where your needs will be addressed. And I think that companies, financial service firms, life science firms, you name it, would be well advised to use their resources to actually build up this network and bring their products to the fore. Because I think if that community understands what the options are, it will make their lives so much easier knowing what's possible.
Exactly. When we don't know, we don't know. But when we have the information, we can ask the right question to decipher. And that's why we're here at Vibe. I'm so appreciated being in partnership with Fin Partners to be able to have these conversations and bring in the right solution to feature on.
What a privilege to be with you. We're an organization that was created on purpose for purpose. So being with you today here at Vibe is a real privilege.
We so appreciate you, and then thank you everyone for watching this.
So what are some of the insights that you have taken away from my conversation with Gil? Anything that you can do immediately to be able to involve caregivers more in your sales and marketing process? Now, next up, in including the entire ecosystem, we have interviewed Stacy Harris from Mocingbird, who is the growth advisor, where their solution is a fresh perspective on the difficulty of clinicians getting re-credentialing. Think about it. All of us who has go through credentials every couple of years, or when you start a new hospital coverage, the process takes months. And just remember which are the entities and criteria you need, especially to keep up with our continuing education credits, is such a pain, especially each state has different regulations on what you need to maintain for your accreditation. Mocingbird has an interest take on how to not hold physicians and other clinicians back from the countless hours that we need to spend on maintaining our continuing education. Mockingbird's solution with their technology platform are able to gather and very quickly screen the right information we need to maintain our license. Let's hear from Stacy on what is her actually simple way to help all of us clinicians to continue to do what we love to do the most. Now, if you are someone who is a founder, who's an expert, that has a great solution to share, we want to hear from you. Apply to be one of our speakers at theprovidersedge.com. Can't wait to hear your amazing story. Hi, this is Sabrina Runbeck with Caregiving Worldwide Network. We have Stacy Harris here with us from Mocingbird, and we're talking really about how do we better support
the clinicians in the healthcare system so we can actually create better patient care. We all know people are having different learning styles, and some people reading, learning, and we know podcasting has been blowing up, video format, and even we create these long video format. People don't want to watch all of it. They want to chunk pieces, and so they can be on the go and be convenient for them. So it's exciting to say, hey, you guys are creating something keeping in mind on how can we be more compliant with all the licenses from all the clinicians, and some of us have multiple licenses across multiple
like
states,
you with 6 of them,
to say, hey, there's a specific topics we actually need to learn. Where do we find this information? And is that just like a last minute learning, or we can already fulfill it by the way that it becomes entertaining also to us? So how have you guys been truly pushing the platform out to make sure your go-to-market strategist is getting the solution to the right people that truly need them?
Yeah, so thank you. We started with a really natural fit with digital health and multiple state licensure. We actually find ourselves being the infrastructure tool to support the front end of telehealth. So that was a pretty natural fit. Now we are definitely going more into the health systems and to your point of how they learn, right? Not all the clinicians of today want to go to Maui for a conference. That's not the way they learn. And to your point, it's between cases. It's not on Saturday when they're normally home with their family. So just letting their time outside of the hospital, outside of the practice matter, and then learning those bite-sized chunks, get the required education out of the way so the rest of the learning can actually be relevant, make them better clinicians, because you're lifelong learners. That's what it's all about. We have all this innovation, clinical studies, new diagnoses, but if we have burnt out clinicians, they're not going to be at the bedside to actually treat these conditions for all of our families and ourselves.
Exactly. It's really truly figure out how do we reduce the burden of all the administrative things that they already been doing. And now they have to keep up with the licensing, keep up with the knowledge so they can give the most critical information and be able to say, I'm creating and delivering high quality care because I have the knowledge to back us up. And despite of how many years that we're doing medicine and practicing it, there's always like 5 new innovation coming out.
Absolutely.
So how do we even learn about these things to be able to aid our daily routine with our patients? Now, there's always exciting moments, right, in business. What has been some of the big win for you guys?
There's a lot. Personally, the big wins for us are when we see clinician CME is not a popular subject. People don't bring up CME and they're like, woohoo, amazing, it's this new innovative tool. No, CME is this back process that just has to be done. So to see that learning is coming on the forefront again, for them to say, oh, this doesn't have to be so hard, and actually have already secured that, and it's all automated, and they know exactly what they need to do by when, that's fun. But what we're watching is other support staff, for the fortunate clinicians who even have them, they're able to do higher value items, things that aren't just paperwork on the backside. So we're actually watching enjoyment come, and we're watching clinicians who might want to leave, might be burnt out, might be looking to retire, say, no, actually, this is all under control. I'm going to get another state license. I'm going to even do more, but it's because it's managed and streamlined and easier. So it's a bit of a wellness prevention tool as well. And it's really just removing the clutter of the mind of our brilliant, important clinicians so that they can learn what needs to be learned to take care of all of us.
Right. It's keeping up with all the necessary information, but doesn't feel like, oh, it's a burden.
Correct.
To still have to spend all those hours.
And the organization's buying it. It's a support. You know, the clinicians don't want a trinket cart on Friday. They don't want pizza. Give them tools that exist to help them manage their own time and be organized and be on top of really, really important requirements and credentials that took them many years and a lot of dollars to earn. And we have a shortfall. Like, we need to find more exciting ways to bring clinicians in. And it's going to be with technology, but it's going to be putting them first. People have to pay attention to them wanting to do this work.
Correct. And also we're seeing, even just when we're talking off camera, is about different topics, not necessarily all clinical diagnosis, that people sometimes feel like, oh, it's so overdone.
Right.
And then giving them different variety of topics from policies patient advocacies, to even business, to leadership, to all different facets of making who they are.
Yes.
So they enjoy learning, they enjoy being in those space and gaining credit at the same time.
Absolutely.
How have you seen as we move forward with this? There's always the ups and downs as we're creating new technologies or giving tools, even though we know it's a good thing, but adaptation is always a different difficulty. So if we give you a magic wand and then wave it, one thing would just disappear completely out of the way, so you can truly push this forward to get more clinicians to buy into it and use it. What would be that one thing you need to remove?
We would need to remove the mental history of how it's been done, because it's only been done one way. And that way has traditionally been articles coming out, publications coming out, grant funded. This is what you need to know. And instead, it would be allowing these requirements and the relevant learning to bridge in the middle. So this is really working. Like, we don't create content at Mocingbird. We just connect you to it. So we're working with brilliant content creators. And the more that they see that we have an avenue to get it out there and that there's multiple ways that you can learn it, but it's really understanding there's a new way. I always use the example of TurboTax and Waze for driving. We could all find where we were going, right? We had maps. We know directions. The clinicians can figure it out. But if there's an easier way, why not give it to them with real life timing and realities attached to it, right? They deserve the best, fastest, most efficient way to learn. And I think that people you're a hard audience. Everyone's trying to get your attention, but this is really built by them for you, by them for them. And that's unique. That's a differentiator for us.
We all know no matter what are we presenting solution to other, it's about that unique ability, because then we can truly say, hey, how can we break away from that traditional norm to actually make things easier, better, and more supportive? Now, we all love being in events, and that's why we're at Vive. So what truly brought you guys to Vive, and what are you hoping to get out of it?
So we love Vive and health. I think it's where innovation meets healthcare. We're a startup health portfolio company, and startup health has been phenomenal to us. So we're always in one of their transformer units. And what we're finding is just there's so much energy right now. There's so many partners, but we believe in partnering together, innovating around the edges. That's the way to succeed, slow and steady. We're going to get there, but it's going to take all of us to do it together, focusing on the same things. And for this podcast and for what we're doing at Mocingbird, it really is the clinician's ability to see more patients, take care of patients, and let that come to the forefront again.
Yes. It's then the clinicians and caregivers truly can trust the quality that they're bringing in, because they're not staying in the old school way, and they're continuously wanting to improve themselves and to be better for their patients. And which is really everything that we're doing here is all funneled back to how do we improve the quality or prevention of the overall care for our patients and caregivers. Now, how can people find out more about you guys and talking to you guys to have a conversation?
I love it. Stacy Harris at Mocingbird. You could find me anywhere, but www.mockingbird.com. Something we're really proud about is our team. We are all very, very experienced and there, and you're going to find one of the things that we are hearing. You get the same people on the phone. Once you work with us, we really care because we know how important your credentials are. So we're never going to lose sight of that. You're going to get the same people on the end of the line. And we're just looking to leave things better than we found them, especially for the next generation of clinicians, especially for the students born with phones in their hands. They're not going to tolerate the old way of learning. So it's time that we bring it up to the moment. Like, we have to seize the moment, and learning is everywhere. But we have to make it accessible.
Perfect. Thank you so much for sharing this with us and for this amazing new way for us to be more connected to the right information.
And thank you for doing what you do day in and day out for patients. Thank you.
Today, we heard from Gil where we need to include human element, the critical part of caregiver, and the entire ecosystem for a patient in order for them to change their behavior, actually truly adapt and insert your product and services into their lives so you can create a better impact for these patients' health. And we also discuss how to include the other spectrum of the ecosystem, which are clinicians, on helping them to not burn out and focus on patient care, the part that we actually trained for many years and enjoy doing, instead of how do I maintain my lessons? How do I make sure I can keep practicing? Now, what are some of the elements that you can use immediately to adapt into your company, whether it's helping the clinician side or the patient side to get more buy-in, so not only they get the initial excitement of what your product service can do for them, but they actually keep using it. Because we all know if we don't have a true client retention and breaking through the trust in the initial and is very important and difficult, but also maintaining their behavior to continue the work is even tougher. We also want to hear from you. I'm curious, how do you see a balance between human and technology in what you are doing right now? Take a screenshot or post it directly on LinkedIn. Whether you are a healthcare leader, a founder, or someone just interested in the health and wellness space, what are some ways that you have been leveraging technology but not getting too far off the beating path of the human element in order to create a bigger impact? Now, if you haven't done so already, subscribe to our channel and our shows and make sure you ring that bell. And I would love to even have a personal conversation with me. Make sure to tag me, Sabrina Runbeck, for your post or drop me a private message on LinkedIn. Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.